What are healing and side effects like after TrichoStem hair regeneration?
Men and women who've undergone surgical hair transplants are familiar with the considerable healing time after surgery that often takes a full day to actually have that surgery performed. These days, many people are undergoing generic PRP or PRP plus ACell treatments, which require frequent visits and multiple, often very painful injections. So it's no surprise that people who see the results we've had with our combination treatment of PRP and extracellular matrix by ACell, which we call TrichoStem Hair Regeneration, they want to know more about what they can expect after they have this treatment. I'll describe what the process of the procedure is like, as well as what the healing process is like afterwards. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been practicing in New York City and Long Island for over 25 years. Around 2011, I was using a material called extracellular matrix by the company ACell for advanced wound healing to help hair transplant surgery, facial cosmetic surgery, as well as tissue grafting procedures. Focusing specifically on hair transplant surgery for better graft survival and donor area healing. I was delighted to observe that a year after surgery that the transplant results had improved and that native existing hair had increased in number and had thickened considerably. This inspired me to develop a non-surgical treatment to help male and female pattern hair loss. The success of my system has become a benchmark for non-surgical hair restoration, with patients coming from around the world for the TrichoStem Hair Regeneration system. After many years of medical colleagues being dismissive of my work, it's quite vindicating for me to see how in the past few years they've all changed their minds and are offering PRP or PRP plus ACell treatments. Interestingly, many of our TrichoStem hair regeneration patients come to us after undergoing PRP scalp injections performed elsewhere. They come to us out of frustration after undergoing several treatment sessions without improvement. Another reason they come to us is that they could not take any more of the pain of PRP injections in their scalp, which they had to endure every month to every 2 to 3 months. Many practices offering PRP scalp injections or even other formulations of ACell plus PRP choose not to use anesthetic as part of their treatment protocol. Some people who've undergone these painful injections have stated that their doctor told them that anesthetic would reduce the effectiveness of their treatment. These generic protocols and beliefs do not, in my opinion, meet the unique needs of every individual patient. Essentially, one size fits all doesn't apply in any area of medicine, including non-surgical hair treatment. I developed TrichoStem Hair Regeneration and customized systems for patients based on gender, age of onset of hair loss, rate of hair loss, and extent of hair loss. In addition, I look at other medical factors. As far as numbers of treatment sessions are concerned, a TrichoStem hair regeneration patient will typically only need 1, maybe 2 treatment sessions to thicken thinning hair and stimulate growth from dormant hair follicles, with the results lasting 3 to 5 years. As far as pain is concerned, we use both topical and local anesthetic, so my patients are comfortable when I place the TrichoStem hair regeneration formulation I determined for them into their scalp. Our patients feel fine after their injections and have their scalps massaged immediately afterwards, and some patients may feel some mild scalp soreness and tenderness for a few days afterwards. In contrast to people in other practices where you have to go back for repeated monthly injection sessions, a TrichoStem hair regeneration patient with more advanced hair loss may receive just a second treatment around 18 months after their first. You can just think for a moment about how much more expensive and physically painful monthly generic treatments are in comparison to what we do. We are committed to our patients' success with our treatment, and we monitor the results with office visits every 3 to 6 months for the duration of typically 2 years. We follow up with patients who are unable to see us in person afterwards with video consultation. People also often ask if there are side effects associated with TrichoStem hair regeneration, or even, for that matter, PRP injections. Short-term swelling, tenderness, bumps, maybe some hair shedding are usually resolved in a few days to a few weeks. I have not seen any consistent or significant long-term side effects of either PRP alone or TrichoStem hair regeneration. As I mentioned earlier, TrichoStem hair regeneration is a system where we look at other medical factors contributing to your hair loss. This means that additional medical strategies can be employed to maximize the longevity of the benefits of our treatment, such as the use of DHT blockers like finasteride. So in summary, recovery time after TrichoStem hair regeneration is basically minimal. We regularly have patients coming from around the world who get back on a plane the same day as their treatment and go home uneventfully. Results typically last 3 to 5 years after a single treatment session, and a patient with more advanced hair loss will often come back for a booster treatment after 18 months from their first treatment. So I hope this information from my experience has helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.